Good morning and welcome to the 9:30 call. We'll give, folks are still joining, so maybe about 15 more seconds and then we'll get started. It's great to see folks this morning. We are coming to you live from Washington, D.C. this morning, which is buzzing with activity due to Benjamin Netanyahu's visit to Congress today. So we have been advised, so our meetings, many meetings got moved to virtual because the security is very tight at the Capitol. So we will not be going. I did walk by the White House this morning, so that was good to see. As we've been doing, we are offering time to each of the Early Childhood Agenda Workgroups to join us here on the 9:30 call to share an update, share any asks or information they have about their workgroup. And so we are so happy to have this morning workgroup number 9 with us. And so I'm going to turn it over to Alex, Janet, and Allison, who will give us a quick who you are and how you came to be in your current role. And then I know you have an update. Also, just want to thank everybody yesterday for joining us on the 9:30 call in the morning in Spanish. To our incredible hosts, Harold and Paula, who did an incredible job leading the call. And to everybody who came back when we didn't have the Zoom enabled for translation and had to have everyone come click off and then come back in. Good morning, Paula. So thank you so much for that. And we realized that Neri recorded the call in Spanish. And so we think that is posted and up. So please share that. But we're going to have another 9:30 call in the morning in Spanish in August and one in September. So stay tuned for more information. Okay, Alex, Janet, and Allison, I'll turn it over to you.
Awesome. Thank you so much, Amy. I'm Alison LeBlanc. I'm Executive Director of the Child Health Equity Center at UMass Memorial Health and UMass Chan Medical School. We do a lot of research, policy work, and programming to address threats to child health across Massachusetts and the region. We have been really excited to be working with colleagues from Reach Out and Read on this amazing priority, number 9. And so I will kick it over to Janet to introduce herself.
Thank you. I'm Janet Boswell. I'm with Reach Out and Read's Northeast affiliate. Reach Out and Read is a 35-year-old organization that equips pediatricians and other healthcare providers who do pediatric primary care to promote early literacy and relational health. And my colleague, Alex Chu, is our regional executive director, and he attends these meetings a lot more often than I do, so he's probably a very familiar face there.
Awesome. Thanks so much, Janet. So we're going to hop on some slides. I'm not going to put them in the slide mode because it's a little harder to see, but hopefully this is coming in clear. I know most of you are familiar with the Early Childhood Agenda, but we just put sort of a little description of the priorities here, and then our priority, which is number 9, strengthen links between health and early childhood systems. So this is really part of the healthy beginnings part of the agenda. And the workgroup facilitators whom you've met are the Child Health Equity Center and Reach Out and Read. And so part of the reason we came to this meeting is we have this big task ahead of us. You know, health systems are really complicated just by themselves. Early childhood systems are really complicated just by themselves. So trying to take very complicated, highly regulated systems and create a legal, sustainable linkage is a challenge. And so we wanted to share this with you and try to get some feedback from folks that have a lot of stake in this work. But we wanted to keep some things in mind first. So we really are looking for sustainable change here. And that requires sustainable funding. And so we've had a lot of folks give us some really great suggestions about a specific program at a specific health center that works and is funded by private philanthropy. That's all wonderful, and we love that, but that's not always scalable. And so we're trying to think a little bit about what's realistic, what exists, and what really will be able to come to scale. Because the last thing we want to do is create a linkage and a disparity. The linkage between some high resource areas and there's no linkage in lower resource areas. So that's the single system solution we're trying to seek here. You know, and we also really are not thinking about relying on philanthropic dollars. So we would need to incorporate some policy changes to sustain this work. I think philanthropic dollars are amazing. The Child Health Equity Center benefits from them, Reach Out and Read benefits from them, and that's wonderful, but they're not sustainable for a statewide initiative to create linkages between systems. And then the final reminder is that this work is really focused on children 0 to 5, not school-age children. And so we may have some great ideas in the school-age children realm, but for this particular activity, we're going to be focusing on the 0 to 5 space. And so we created a little bit logic model theory of change to help situate folks to what we're thinking. And I don't know, Alex, if you'd like to kind of walk through this vision, or I can help do it, whatever is beneficial for you.
Oh, I'm happy to walk through this. So one of the things that is a particular opportunity and challenge with the health with number 9 on the agenda is that the topic is very broad. When you think about early childhood systems in healthcare and creating linkages, you could say things like, well, is this linkages with pediatricians? Is this linkages with nurse practitioners? Is this linkages for early child care providers that have health consultants? Is this linkages to healthcare in people's homes and thinking about developmental monitoring and surveillance? And so one of the challenges that this group had was wrapping our hands around what does it mean to what does the healthcare system that we are hoping to influence mean? What does the early childhood healthcare system that we're hoping to influence mean? And what do we mean by the linkages? One way to do that is to think about all of our conversations in terms of a logic model or a theory of change, which essentially takes all of the ideas, all of the activities, and tries to organize them in a way that makes sense so that we can keep this conversation moving forward and have very clear outcomes and impacts that we're trying to align those conversations towards. So what you see in front of you is an organization, so you could kind of read this from left to right, where you have inputs into what we hope to achieve. And at the very far right of this chart is the impact that we're hoping to achieve. Now, if you work backwards from right to left, you could see that the strong link between healthcare systems and early programs and services is what we're trying to accomplish. One column before that, the yellow column, is longer term outcomes. And so when we talk about things like altered payer environments, improved patient experience, closed loop referral, theoretically, in a theory of change or a logic model, if you were to take all of those longer term outcomes and accomplish all of those, that would lead to the impact that you're looking for. Subsequently, if you were to take a step even further to the left in a shorter term outcomes column, the green column there, the same logic or principle sort of applies. If you take all of those shorter term outcomes, and I won't read them all for you, but if you take all of them and try to accomplish them as best as possible, that leads you to a collection of some of the longer term outcomes, which then leads you to a collection of impact. And the way that a logic model or a theory of change is structured or set up is that you start with sort of the input that leads you to activities that you will actually do as part of the work. And so when we're thinking about, to zoom out a little bit, when we're thinking about what are our opportunities that we want to be able to present the early childhood agenda as a whole for activities that we need to engage in, these are the activities as they are informed by both the input that go into that and the outcomes that we're trying to achieve. Does that work for you, Alison?
Oh, I'm on mute. Sorry, that was perfect. I was saying it was perfect, Alex. And thank you so much for walking through that. And I know this is a lot of text on a page. I would never normally put this on a slide, but we wanted to show you, and then we're going to actually post these in Basecamp. So you're going to be able to access this slide and you can kind of orient yourself to it And that hopefully will be helpful as you're helping us with this work. And so this is sort of.
I just want to highlight, Allison, lots of positivity in the chat about the model and the chart.
Awesome. So I think, this is really the 3,000-foot view approach we're taking. We just want to remind people we're going to ask some questions in the next slide, but we want to make sure we're kind of taking it to a high level where we can create that sustainable, scalable change we had talked about in the beginning. And so here are the survey questions, and they're loaded questions. Acknowledge they're loaded questions. We have the survey link. It's going to be posted in the chat, and I'll also have a QR code in the next slide. But we wanted to just show you the questions so that you can see what we're looking for. So we're asking people to name 3 or 4 existing groups of providers and professionals that will experience a meaningful change because of our work. So if we create this linkage, and knock on wood, we're going to do it, who is going to have a meaningful change as a result? And, if you want to say doctors, for example, could you be a little more specific? Do you mean pediatricians? Do you mean nurse practitioners? Do you need both? So any type of specificity you could offer would be really helpful. Like when you say families, is it just specifically families of newborns, or is it all families of children 0 to 5? And then our second ask is for you to describe in one sentence the characteristics of a strong link between healthcare and early childhood. And so this is really important because I think in our work, we've really noticed, and it totally makes sense, that people identify more with one camp. They're either more familiar or more embedded in healthcare, or more familiar or more embedded in early childhood. And so we want to get both those perspectives and then use them to create this link. So to really understand where everyone's coming from, all of the barriers and pain points that we're seeing on both sides of the system, and what a strong link would look like. Because the strong link may not look exactly the same for both systems. So then once we have a sense of what those look like, we can see how can we change that a little bit so it would work for both sides of the aisle here. So this QR code should, if I know how to do a QR code, take you to the survey. If not, Neri is going to put it in the chat because I'm not super technological, but I was super proud of myself for doing that. So we'd love for you to take our survey. It will take some time. These are really big questions. They're big questions, and we're asking them because we don't have the answers. And so, you may need to take some time. You may need to think about it. We're also happy to schedule a meeting with people to talk through or to accept emails with more comprehensive responses. Like if you feel like, gosh, I have some feedback and it isn't related to one of those questions, do not censor yourself. Like, give us that feedback. We're totally open to it. Don't feel like you have to stick to that one thing. And then I think Janet is going to share a little bit more about who's filled out the survey so far and who we really need to participate moving forward.
Right, so we've gotten about 15 responses, and ideally we'd like to have more like 25. And I'm looking at all of these squares on this meeting today and thinking there's some great candidates here. We have about a third of the respondents so far are people who identify as ones, and we have a lot of 3s, but we don't have many 2s. And generally speaking, we have had more difficulty getting people in the healthcare field than in early childhood, just because their demanding schedules make it really difficult for them to participate. And we're looking for alternative ways of obtaining their feedback, like sharing the theory of change with them and just asking them to have a quick conversation with us. But in general, if you know of people in the healthcare or early childhood field who would be willing to take some time to think about these questions, that would be terrific.
Awesome. And, you know, we have heard from a few people that the survey, which is in Google, is not accessible via some computers if you're using a work computer. So you can either hop over your personal computer, or like I said, you can just go ahead and send an email if that's easier, and you won't be able to get into that Google survey. And so we are really grateful for everyone doing this, and we wanted to show you how much we value your time. And thankfully, Amy and the Strategies for Children team were in alignment about this. So anyone who completes the survey, including if you do survey answers to our email, will be entered to a drawing for 4 $25 Amazon gift cards. And Lord knows you can get anything on Amazon these days. So anything your heart desires, up to $25. And so we really would love to hear from you. Feel free to send the survey along to folks that are not in this meeting. You feel like, oh, I have a colleague or a friend that would want to give feedback. Share it widely. They don't have to be linked into the agenda specifically. We want as many responses as possible. And so that is sort of our presentation, and then we wanted to open it up to some questions. And I apologize, I have not been following the chat. But if there's any questions in the chat or anything that we should address, feel free to raise a hand or call it out.
Thanks so much. It's so exciting to see the progress. As I said, there's Mary's also been populating in the chat with lots of content information. And just a flag, Amaris added that the governor's interagency task force on early education care continues. The listening sessions, if you've been following them on social media, they have been out and about. So thanks, Amaris, for that information. And so Chris Marino said that he can't wait to share with the policy fellows at Teach Plus the model of the chart. Alex shared that the QR code worked. Edna says this is wonderful, as many families rely heavily on and trust their medical providers. Medical providers are often the primary trusted entity for families because they are among the first professionals who families developed a relationship with. And Neri added everybody's contact information, the Google form. Kim wonders, in terms of sharing the model and survey, do you have some cover email language you could use? We could use, as we affectionately call it, SFC, a blurb. Do you have a blurb that people can share?
We absolutely do. We have a blurb that Janet kindly created for an email. And then we also have a blurb at the top of the survey. So if for some reason someone sees the email and then they forget by the time they click the survey, which I would totally do, they'll also have that blurb right in the survey that they should just scroll up and kind of remind themselves. So we'll definitely share that on Basecamp as well. The slides will be on there, available by email, telephone, text message. Don't send me mail. I won't get it. I'm a millennial. So other than mail, we're here for you, and we want all of your feedback and responses.
And then Edna started writing, do you have a letter or something in paper that family child care providers could hand to our parents? So that would be another, maybe we can add something to Basecamp that's more of a letter form that folks print out. And then Lisa Powell says it would be good to share with the IECMH, Infant Early Childhood Mental Health Integration in Primary Care Workgroup, either by email or by coming to the next meeting to talk about the work. Happy to help with that connection. So thank you, Lisa. Titus, I see you have your hand up.
That's
Thanks,
great.
Amy. Well, this is very impressive. As someone who works with Workgroup 4, we're also refining our recommendations, and we'll be sharing them with the 9:30 calls soon. But we don't have a logic model like this. So this is very well thought out and comprehensive, and I'm sure you've covered a lot of the policies that are and the opportunities that are, able to be changed. So my question is, based on your survey responses so far and your work group attendance, are there any groups or types of responses that you have not, or types of voices that you've not heard enough from at this point? You know what I mean? Like who specifically would you really, on your wish list, would you really want to fill out this survey so that the survey can be more representative?
My biggest sort of absent voice is the mass health and commercial payer voice. I think for this to be sustainable, we need policy reform that changes reimbursement. And we have not had anyone from mass health or from the commercial payers, because this is going to affect all children, commercial and public insurance. So that is one area where we really like to see some participation. And then in addition, as Janet mentioned, we're missing the healthcare voice a little bit. It's mostly me just talking really loudly. And we need a couple of other voices from healthcare, particularly if we had a family medicine doc or pediatrician, or a nurse practitioner, social worker, those types of folks we would love to hear from. Alex or Janet, are there any other groups we're missing?
No, I think that covers it.
And Kim Davenport added the Mass chapter of the American Academy of Pediatrics. And I think both for group 4 and group 9, we're thinking about outreach in general to those groups, and where are the opportunities. So thanks for that, Kim. Thanks, Allison. Mary, I see your hand up.
Yeah, thank you so much. I just want to let you know, I am a pediatric nurse practitioner, but I also have been hired by EEC, the Department of Early Childhood Education, along with Claudia Catalano, to develop a health and safety consultation model. And so our work is we really should collaborate on this. We have been talking to a bunch of people across the Department of Public Health, that's where we're situated, and also a bunch of other outside agencies. We're going to be talking with you very soon, Amy. But this is a huge issue for the licensures and the regional directors and the early childhood providers getting access to medical information so that they can be compliant with their individual health plans and all of the things they need to do to stay in compliance with the regulations. And so I just wanted to introduce myself. I've been sitting in on these calls. They're wonderful, but I just wanted to make sure that you knew about us. And that is another group, the EEC group is another group that really should be included in this discussion.
Absolutely. We'd love for you to either forward us their information or forward them the survey, whatever's easier. That sounds great.
I did do your survey, so I did it, but I will make sure that I get that out there. Thanks.
And I think, Mary, thank you so much for taking that time to introduce yourself, because I think that's exactly why we want to feature the work groups on the 9:30 call, right? We had 60 plus people on this morning. We know that the work groups are also running monthly meetings for the Early Childhood Agenda. As SFC staff person is kind of sitting in on all of those work groups. So we're trying our best to look for opportunities of alignment and connection, but including the 9:30 call. So that was a perfectly placed connective tissue. So thank you so much. Any last words, Allison, Janet, or Alex?
The only thing I wanted to just share is we are still meeting virtually as a work group. So if there's anyone on this call that's like, oh gosh, maybe I'd like to join that work group, please do email us. We are certainly not closed. We are open for business, accepting new members every day. Even if you can't make every meeting, you'll still get the emails and information and things coming from, Neri all the time. She's doing a great job of keeping us organized. And so the next meeting, yes, you did put it in the chat, is August 9th. And, we would love to see more faces. And again, feel free to share that invitation with others as well. Alex, Janet, final words?
No, thanks for that reminder. And I'll be sending out a reminder email about the meeting as well.
I do think one update is needed. Since last time we met at Polar Park, Alex Chu was about to get married. So Alex, give us how'd everything go?
It went splendid. We are still married. A whole quarter later. It was a beautiful ceremony, and Amy, we were at the Boston Public Library. It has a wonderful elopement little section off to the side, and they were lovely and amazing human beings over there. So if you all get the chance to check out, we're very pro-library over here. So please do support them and check out the library. They do great stuff over there.
Were you wearing like a reach out and read pin or something?
I think it may have gotten us some bonus points when it's getting the elopement spots are sort of like signing up for Taylor Swift tickets. You have to be at 12:01 hitting the refresh button in order to sign up. But it was great. They did a great job.
Well, that's great news. So a programming note for the 9:30 call. Tomorrow we have a team from UMass who are going to talk about their new research brief. We have kind of a switching guest speaker, so I'll send that kind of updated list of speakers today. Next week we're going to hear more from the Children's Museum and Horizons for Homeless Children, an initiative that they talked about the first time they were on the call. And on Tuesday of next week, we're going to have a special edition of the 9:30 call that will last until 10:30. Aditi and Christy will join us, and they asked if we could try an extension of the 9:30 call. So we were going to try that next week because oftentimes we run out of time when we're kind of with them. And then we're going to hear from Project Bread about summer meals, and then we're going to hear from Eric Nelson from Community Playthings about the work that they're doing around supporting children. So thank you so much, Workgroup 9 and the leaders. Yes, Kim Davenport, keep going to all the work groups. We are all engaged in this experiment together, and it's so exciting to see the way things are playing out. So appreciate your work, appreciate everyone joining us today, and we will see you tomorrow on the 9:30 call. Take care.